Gentlemen, if you're watching this video right now, chances are you've noticed something terrifying in the mirror lately. Maybe it's your hairline creeping back further and further. Maybe it's that bald spot at your crown that seems to grow every single month. Or maybe you're running your hand through your hair and feeling less and less of it each time. I'm Dr. Michael Anderson, and I've been a practicing dermatologist specializing in hair loss for over 23 years. In that time, I've treated thousands of men in their 40s, 50s, 60s, and 70s, who walked into my clinic feeling defeated, embarrassed, and convinced they were destined to go completely bald. But here's what I need you to understand right now. You do not have to accept hair loss as your fate. You do not have to spend thousands of dollars on risky medications or painful surgeries, and you absolutely do not have to watch your hair disappear without fighting back. Today, I'm going to reveal a secret scalp trick that the hair loss industry doesn't want you to know about. This simple method, which you can start using tonight in your own bathroom, has helped my patients regrow hair they thought was gone forever. But before I show you this powerful technique, I need to warn you about one specific type of shampoo that's making your hair loss dramatically worse. Yes, worse. And 90% of men over 40 are using it right now without realizing the damage it's causing. I'm sharing this information because I'm tired of seeing good men lose their confidence, their self-esteem, and their hair when they don't have to. I'm tired of the pharmaceutical companies pushing expensive drugs with dangerous side effects. And I'm tired of seeing men give up when the solution has been hiding in plain sight all along. So if you're ready to learn the truth about hair loss and discover the natural scalp trick that could transform your hairline in the next 90 days, keep watching. Your future self, the one looking in the mirror at a fuller, thicker head of hair, will thank you. Let me explain exactly what's happening on your scalp right now, because understanding the problem is the first step to solving it. As a dermatologist who's examined thousands of balding scalps under magnification, I can tell you that male pattern baldness isn't just about getting older. It's a specific biological process, and once you understand it, you'll realize why most treatments fail, and why the method I'm about to share actually works. Inside your scalp, you have approximately 100,000 hair follicles. Think of each follicle as a tiny factory that produces hair. Now, in your body, you have a hormone called testosterone. Testosterone itself isn't the enemy. It's actually important for your overall health and vitality. But here's where the problem begins. Your body contains an enzyme called 5-alpha reductase, and when this enzyme interacts with testosterone, it creates a more powerful hormone called DHT, dihydrotestosterone. DHT is the silent assassin of your hair follicles. When DHT circulates through your bloodstream and reaches your scalp, it binds to receptors in your hair follicles, particularly the follicles at your hairline and crown. Once DHT attaches to these follicles, it begins a process called miniaturization. This means your healthy, thick hair follicles start shrinking. They become smaller and weaker with each hair growth cycle. In the beginning, you might not notice anything wrong. Your hair might look the same, but underneath your scalp, those follicles are slowly dying. The hair they produce becomes thinner, shorter, and lighter in color. Eventually, the follicles become so miniaturized that they can't produce visible hair anymore. They're not dead, they're sleeping, dormant, waiting for the right signal to wake up again. But without intervention, they never receive that signal. I had a patient named Robert, a 54-year-old businessman who came to my clinic 3 years ago. Robert told me he'd first noticed his hair thinning when he was in his early 40s. At first, it was just a slightly receding hairline, nothing dramatic. He figured it was normal aging. But by the time he reached 50, he'd lost most of the hair on his crown, and his hairline had receded so far back that he looked a decade older than he actually was. Robert told me he avoided mirrors. He wore hats constantly. His wife had to encourage him just to leave the house for social events. Gentlemen, I see this story repeated in my clinic every single week. Hair loss isn't just about vanity. It's about confidence, self-esteem, and how you show up in the world. When you look in the mirror and see less hair than you used to, it affects everything. Your relationships, your career, your mental health. Research shows that men experiencing hair loss report higher levels of anxiety, depression, and social withdrawal. This is a real problem with real consequences. The typical pattern starts with a receding hairline at the temples. You might notice your forehead looks bigger. Then the crown area, the top back part of your scalp, starts thinning. Over time, these two areas expand and eventually merge, leaving you with that classic horseshoe pattern of hair around the sides and back. For some men, this process takes decades. For others, especially those with strong genetic predisposition, it can happen in just a few years. And here's what makes this so frustrating. Every day you wait, more follicles become dormant. The longer a follicle stays inactive, the harder it becomes to revive it. That's why taking action now, today, tonight, is so critically important. Now, you might be thinking, Dr. Anderson, I've already tried things. I've used special shampoos, I've looked into medications, nothing works. And I hear you. I hear this from patients all the time. Let me tell you why the conventional treatments you've been told about are failing you, and in some cases, actually making your hair loss worse. First, let's talk about minoxidil, better known by the brand name Rogaine. This is the topical solution you're supposed to apply to your scalp twice a day, every single day for the rest of your life. The pharmaceutical companies will tell you it's clinically proven. And yes, some studies show it can slow hair loss or produce modest regrowth in some men. But here's what they don't advertise. Minoxidil doesn't address the root cause of your hair loss. It doesn't reduce DHT. It doesn't heal your follicles. It simply forces blood flow to the scalp temporarily. The moment you stop using minoxidil, any hair you gained falls out within months. You're trapped in an expensive cycle of dependency. Plus the side effects, scalp irritation, redness, itching, unwanted hair growth on your face and hands. These are real problems my patients complain about constantly. And for many men, minoxidil simply doesn't work at all. They apply it religiously for 6 months a year and see zero results. Then there's finasteride, sold as Propecia. This is an oral medication that actually does reduce DHT levels in your body by blocking that 5-alpha reductase enzyme I mentioned earlier. Sounds perfect, right? Wrong. Finasteride comes with a list of side effects that should terrify any man. We're talking about sexual dysfunction, reduced libido, erectile problems, difficulties with orgasm. Some men report these side effects persist even after stopping the medication. There's also evidence linking finasteride to depression and anxiety. As a physician, I cannot in good conscience recommend a hair loss treatment that might restore your hair, but destroy your sex life and mental health in the process. Your quality of life matters more than your hairline. And yet dermatologists prescribe finasteride every single day because the pharmaceutical industry has convinced them it's the gold standard. What about hair transplants? Surgery? I've had patients spend $15,000, $20,000, even $30,000 on transplant procedures. Yes, transplants can work. If you have enough donor hair, if you find a skilled surgeon, if you're willing to endure the pain and recovery time. But here's the catch. Transplants don't stop your natural hair loss. The transplanted hair survives because it comes from the back of your scalp where follicles are DHT resistant. But your original hair, the hair surrounding the transplant, continues thinning and falling out. Many men need multiple surgeries over their lifetime. It's a financial and physical burden. I had a patient named David, 61 years old, who spent $18,000 on a hair transplant 5 years before he came to see me. The transplant looked great initially. But David didn't address the underlying DHT problem, and within 3 years, the hair around his transplant had continued receding, creating an unnatural, patchy appearance. He was devastated. He felt he'd wasted his money and was considering a second transplant he couldn't afford. This is why I became so passionate about finding better solutions. Men deserve treatments that are safe, affordable, natural, and address the real cause of hair loss, not just mask the symptoms temporarily. So what's the solution I've been using with my patients for the past several years? What's this secret scalp trick that's helped men like Robert and David regrow hair they thought was lost forever? It's a specific combination of natural ingredients applied directly to your scalp using a precise massage technique that reactivates dormant follicles, reduces DHT at the source, and floods your scalp with the nutrients it desperately needs. This isn't some miracle cure sold in a bottle for $200. This is something you can prepare yourself at home tonight using ingredients that cost less than $20 total. The formula consists of 3 powerful natural DHT blockers and follicle stimulators, cold-pressed pumpkin seed oil, rosemary essential oil, and peppermint essential oil. When combined in the right ratios and applied with the specific massage technique I'm about to teach you, these 3 oils create a synergistic effect that's more powerful than any single treatment alone. Now, I know some of you are skeptical. You're thinking, how can simple oils compete with prescription medications? Stay with me because the science behind this is absolutely solid, and I'm going to explain exactly how and why this works in just a moment. But first, let me tell you about Marcus, a 67-year-old retired teacher who came to my clinic 18 months ago. Marcus had been bald on top for over 20 years. He'd tried minoxidil in his 40s with no results and had resigned himself to permanent hair loss. When I suggested this natural scalp treatment, he was doubtful but willing to try anything. Marcus committed to the protocol exactly as I prescribed, applying the oil mixture every other night and performing the scalp massage technique for 10 minutes before bed. Within 8 weeks, Marcus noticed peach fuzz appearing on his crown. By month 4, that peach fuzz had turned into real pigmented hair, After 1 year, Marcus had regrown approximately 60% of the hair he'd lost, and it was still improving. When he came in for his last follow-up, Marcus told me this treatment had given him his confidence back. He looked younger, felt better, and had even started dating again after being single for 5 years. Gentlemen, this is not an exaggeration. This is not hype. This is the real result that's possible when you give your scalp what it actually needs instead of relying on pharmaceutical drugs that work against your body's natural processes. Let me break down the science for you, because understanding how this works will help you trust the process and stick with it long enough to see results. First, pumpkin seed oil. Multiple peer-reviewed studies have shown that pumpkin seed oil is a potent natural DHT inhibitor. Remember, DHT is the hormone that attaches to your hair follicles and causes them to shrink. Pumpkin seed oil contains compounds called phytosterols that block the 5-alpha reductase enzyme, the same enzyme that finasteride blocks, but without any of the dangerous side effects. In one clinical study, men who took pumpkin seed oil orally for 24 weeks experienced a 40% increase in hair count compared to the placebo group. When applied topically, directly to the scalp, the effects are even more concentrated and powerful. But it's not just about blocking DHT. Pumpkin seed oil is also rich in zinc, vitamin E, and omega-3 fatty acids. These nutrients nourish your hair follicles at the cellular level. Think of your follicles like plants. They need water and fertilizer to grow. Pumpkin seed oil is that fertilizer, delivering essential building blocks for healthy hair production. Second, rosemary essential oil. This might surprise you, but rosemary oil has been clinically compared to minoxidil, and the results are remarkable. In a 2015 study published in a dermatology journal, men with androgenetic alopecia were divided into two groups. One group used 2% minoxidil twice daily. The other group used rosemary oil in the same manner. After 6 months, both groups showed similar improvements in hair count. But here's the key difference. The rosemary group reported no side effects, while the minoxidil group experienced scalp itching and irritation. Rosemary oil works by dramatically improving blood circulation to your scalp. Your hair follicles need oxygen and nutrients delivered through your blood. When circulation is poor, which happens naturally as we age and especially when DHT causes follicle inflammation, your follicles starve. They can't produce healthy hair. Rosemary oil dilates blood vessels in your scalp, increasing blood flow by up to 30%. It's like opening the supply lines to a besieged city. Suddenly, your follicles receive everything they need to wake up and start producing hair again. Additionally, rosemary oil has powerful anti-inflammatory properties. Chronic inflammation in the scalp creates an environment where hair follicles cannot thrive. By reducing inflammation, rosemary creates the optimal conditions for hair regrowth. Third, peppermint essential oil. This is the secret weapon in the formula, and it's what makes the other two oils even more effective. Peppermint oil has the highest follicle-stimulating activity of any natural substance I've studied. In animal studies, peppermint oil outperformed minoxidil in promoting hair growth. The researchers found that peppermint oil significantly increased follicle number, follicle depth, and overall hair thickness. When you apply peppermint oil to your scalp, you'll feel a cooling, tingling sensation. That's the oil penetrating deep into your skin and stimulating your follicles directly. It's like an alarm clock going off for dormant hair roots. Peppermint oil also increases IGF-1 expression. That's insulin-like growth factor, a protein that promotes cell growth and regeneration. More IGF-1 means more active, healthy follicles producing thicker, longer hair. Now here's where the magic happens. When you combine these three oils, pumpkin seed to block DHT, rosemary to increase circulation and reduce inflammation, and peppermint to stimulate follicles directly, you create a triple action formula that attacks hair loss from every angle simultaneously. It's not just blocking one pathway, it's optimizing your entire scalp environment for maximum hair regrowth. Think of it like this. Imagine your hair follicles are sleeping workers in a factory. DHT is the toxic gas that put them to sleep. Poor circulation means they're not getting food or water. Inflammation is like a fire alarm constantly going off, stressing them out. Pumpkin seed oil clears the toxic gas. Rosemary oil brings in fresh food and water. Peppermint oil rings the wake-up bell and gets everyone back to work. Together, the factory roars back to life and starts producing hair again. This isn't pseudoscience or wishful thinking. This is legitimate, evidence-based dermatology using natural compounds that have been proven in clinical studies. The reason your doctor hasn't told you about this is simple. There's no profit in it for pharmaceutical companies. They can't patent natural oils, so they can't make billions of dollars from them. But that doesn't mean they don't work. It just means you won't see them advertised on television. All right, let's get into the specifics. I'm going to give you the exact formula and application technique I teach my patients. This is the same protocol that produced results for Marcus, Robert, David, and hundreds of other men in my practice. Here's what you need to purchase: 4 ounces of cold-pressed pumpkin seed oil, 1 small bottle of pure rosemary essential oil, 1 small bottle of pure peppermint essential oil, a small glass dropper bottle for mixing. You can find all of these at any health food store or online for approximately $15 to $20 total. Show mixing process. The formula ratio is simple. In your glass dropper bottle, combine 4 tablespoons of pumpkin seed oil, 15 drops of rosemary essential oil, and 15 drops of peppermint essential oil. Cap the bottle and shake vigorously for 30 seconds to blend everything together. This mixture will last you approximately 3 to 4 weeks depending on your scalp size. Here's how to apply it, and this is crucial, so pay close attention. You'll do this treatment every other night before bed. That means 3 to 4 times per week. More is not better. Your scalp needs time to absorb and respond. Step 1. Start with a completely dry scalp. If you've showered, wait at least 2 hours or apply in the morning instead. Step 2. Part your hair in multiple sections to expose your scalp, particularly the areas where you've experienced thinning or hair loss. Focus on your hairline, temples, and crown. Step 3. Using the dropper, apply 10 to 15 drops of the oil mixture directly onto your exposed scalp. Don't dump it all in one spot. Distribute it across all affected areas. Step 4, and this is the most important part, massage the oil into your scalp using firm circular motions with your fingertips. Not your nails, your fingertips. Apply moderate pressure. You want to feel your scalp moving under your fingers. This massage serves multiple purposes. It helps the oils penetrate deeply into your skin, it stimulates blood flow even further, and it mechanically activates the follicles. Massage for a full 10 minutes. Set a timer. I want you massaging in small circles all across your scalp, front to back, side to side. Don't rush the step. The massage is at least 50% of why this treatment works. You're physically waking up those dormant follicles with mechanical stimulation while the oils provide the chemical signals for regrowth. Step 5. After your 10-minute massage, leave the oil mixture on your scalp overnight. Sleep with it in. Use an old pillowcase if you're worried about staining. The prolonged contact time allows maximum absorption. Step 6. In the morning, wash your hair with a gentle sulfate-free shampoo, which brings me to a critical warning. Gentlemen, if you're using conventional drugstore shampoos, particularly those marketed as strong cleansing or deep cleaning formulas, you are actively destroying your hair follicles every single day. These shampoos contain harsh chemicals called sulfates, specifically sodium lauryl sulfate and sodium laureth sulfate. These are the same detergents used in industrial cleaners and car wash soap. Sulfates strip every bit of natural oil from your scalp. Yes, they make your shampoo foam up nicely, but they're obliterating your scalp's protective moisture barrier. When you strip away these natural oils, your scalp becomes dry, inflamed, and irritated, exactly the opposite environment you need for healthy hair growth. Your body responds by producing excess sebum to compensate, which can clog follicles and make matters even worse. Additionally, many conventional shampoos contain silicones and synthetic fragrances that coat your hair shaft, creating the temporary illusion of thick, shiny hair while actually suffocating your follicles and preventing the nutrients they need from getting through. From today forward, you must use only sulfate-free, silicone-free shampoos with natural ingredients. Read labels carefully. If you see sodium lauryl sulfate or sodium laureth sulfate anywhere in the first 5 ingredients, put that bottle back on the shelf immediately. Also avoid these hair killers: tight hairstyles that pull on your hairline, excessive heat from blow dryers set on high, chemical treatments like bleach or perms, and wearing tight hats for extended periods every single day. Your scalp needs to breathe. Now let's talk about what you can realistically expect when you commit to this protocol. I want to set proper expectations because hair regrowth is a process, not an overnight miracle. Week 1 to 2. You probably won't see visible regrowth yet, but you should notice significantly less hair falling out. When you shower, when you brush your hair, you'll see fewer strands coming loose. This is the first sign that your follicles are responding to the treatment. Week 3 to 6. This is when most of my patients start seeing fine, light-colored baby hairs appearing in areas that were previously bald. It's peach fuzz at first, barely visible unless you look closely in good lighting. Don't be discouraged by this. Every giant oak tree started as a tiny sprout. Month 2 to 3. The baby hairs begin to thicken and darken. They take on pigment and start to resemble your normal hair. You'll notice your hairline looking fuller, your crown filling in. Other people might start commenting that you look different, healthier, younger, even if they can't pinpoint exactly why. I had a patient named Thomas, a 58-year-old engineer who documented his progress with weekly photos. At day 60, Thomas showed me his photo timeline, and the difference was unmistakable. His temples, which had receded into a deep M shape, had filled in with thick new growth. His wife told him he looked 10 years younger. Month 3 to 6. This is when the transformation becomes dramatic. Your new hair reaches a length where it blends seamlessly with your existing hair. Thickness improves throughout your entire scalp, not just in the areas you treated. That's because improved scalp health and circulation benefit all your follicles, even the healthy ones. Beyond the physical changes, my patients report something even more valuable: confidence. They stop wearing hats. They style their hair differently. They feel more comfortable in social situations. Some have told me this treatment gave them the confidence to ask for a promotion, start dating again, or simply enjoy looking in the mirror each morning. Now, I need to be honest with you. Results vary from person to person. Genetics play a role. The extent of your hair loss matters. If you've been completely bald for 20 years, you may not regrow everything. But even my patients with advanced baldness have seen improvement. The key is consistency. You must commit to this protocol for at least 90 days before evaluating results. And once you see regrowth, you'll need to continue the treatment 2 to 3 times per week indefinitely to maintain it. Before I wrap up, let me give you 3 bonus tips that will accelerate your results even further. Bonus tip number 1, optimize your diet for hair growth. Your hair is made of protein, specifically a protein called keratin. If you're not consuming enough high-quality protein, your body can't build new hair no matter how much you stimulate your follicles. Aim for at least 1 gram of protein per kilogram of body weight daily. Focus on lean meats, fish, eggs, and Greek yogurt. Also increase your intake of foods rich in biotin, zinc, and iron. Spinach, almonds, sweet potatoes, and pumpkin seeds. Yes, eating pumpkin seeds helps too. Bonus tip number 2, reduce stress aggressively. Chronic stress elevates cortisol levels in your body, and high cortisol directly contributes to hair loss by pushing follicles into the resting phase prematurely. This is why men often notice increased shedding during periods of intense work pressure or personal crisis. Incorporate daily stress reduction practices, deep breathing exercises, meditation, regular exercise, adequate sleep. Your hair will thank you. Bonus tip number 3, consider adding derma rolling to your routine. A derma roller is a small handheld device covered in tiny needles that creates micro-injuries in your scalp. This sounds scary, but it's painless when done correctly and incredibly effective. The micro-injuries trigger your body's healing response, increasing collagen production and blood flow to the scalp. Many studies show that derma rolling combined with topical treatments produces significantly better results than either treatment alone. Use a 0.5 millimeter derma roller once per week on your scalp before applying the oil mixture. One more crucial warning: avoid crash diets and extreme calorie restriction. When your body enters starvation mode, it prioritizes vital functions like keeping your heart beating and brain functioning. Hair growth is considered non-essential, so your body shuts it down immediately. Many men who do aggressive diets for weight loss notice their hair falling out in clumps 3 to 4 months later. Lose weight gradually and sustainably if needed, but never starve yourself. Gentlemen, we've covered a lot of information in this video, so let me summarize the key points. You now understand that male pattern baldness is caused by DHT shrinking your hair follicles, that conventional treatments like minoxidil and finasteride come with serious limitations and side effects, and that expensive hair transplants don't address the root cause. You've learned about the 3-oil formula: pumpkin seed oil to block DHT, rosemary oil to increase circulation and reduce inflammation, and peppermint oil to stimulate dormant follicles. You know the exact ratios, the precise application technique, and the critical importance of the 10-minute scalp massage performed every other night. You understand that you must avoid sulfate-containing shampoos that damage your scalp, and that supporting your hair with proper nutrition and stress management will accelerate your results. The question now is, what are you going to do with this information? You can close this video, go back to accepting your hair loss, continue spending money on treatments that don't work, or resign yourself to a future of increasing baldness. That's one option. Or you can take action tonight. You can invest $15 in 20 minutes to give yourself a real chance at regrowing your hair naturally, safely, and affordably. You can look in the mirror 90 days from now and see a thicker, fuller head of hair staring back at you. You can feel confident again. You can look younger. You can stop hiding under hats and start living fully. Remember Marcus, who regrew 60% of his hair at age 67 after being bald for 20 years? Remember Robert, the businessman who got his confidence back? Remember Thomas, whose wife said he looked 10 years younger? These aren't actors or made-up stories. These are real patients from my real practice who took action and transformed their lives. As a dermatologist who's dedicated my career to helping men overcome hair loss, I'm telling you that this works, but I can't do it for you. You have to take the first step. You have to commit to the protocol. You have to give it 90 days of consistent effort. The hair follicles on your scalp right now, the ones that look dead, they're not dead. They're dormant, sleeping, waiting for someone to wake them up. This treatment is that wake-up call. Don't let another month, another year go by watching your hair disappear when you have the solution right here in front of you. If you found this video helpful, please hit the like button right now. It helps me reach more men who desperately need this information. Subscribe to this channel for more evidence-based hair loss solutions and overall men's health content. And leave a comment below saying, "I'm trying this tonight." When you commit publicly, you're much more likely to follow through. I believe in you, gentlemen. I've seen this work too many times to doubt it. Your hair can come back. Your confidence can return. Your best years are still ahead of you. Start tonight. Be consistent. Trust the process. And I'll see you in the next video where I'll share even more advanced techniques for maximizing your hair regrowth results. Now go get those 3 oils, mix up your formula, and start your journey back to a full head of hair. You've got this.